As the country battles a surge in infections, the Ministry of Health is fighting corruption and malpractice, chronic illnesses at Afya House. Health Cabinet Secretary Mutahi Kagwe is seemingly frustrated by a number of senior ministry staff transferred from plum positions over questionable dealings, but who have since refused to move. Seth Olale reports.
Though the Ministry of Health proclaims zero tolerance to corruption, a diagnosis of the goings on behind the walls of Afya House suggests otherwise. Health Cabinet Secretary Mutahi Kagwe now says he has to up the doors against corruption and official malpractice that he says have afflicted service delivery.
Individuals sitting in very interesting positions refuse to move from that position until you physically send somebody to assist them through that gate. It's a very interesting situation. You know, one would imagine that if you are going to hit the age of 60, you are looking forward, to retirement and you go home.
It's a month now since 30 senior officials drawn from accounts and procurement were moved from their influential dockets at Afya House for questionable conduct. However, some have remained put. They include Under Secretary Morekwa Moranga, Hezekiel Chepkwon, who is the head of National Quality Assurance Laboratory, his deputy Pius Wanjala, and Frida Govedi, who's the head of Kenya National Blood Transfusion Service.
I have been around for a long time, Seth, and I have honestly never been in any institution where people refuse to be transferred. I have never seen it.
Cartels which have turned Afya House into Mafia House have over the years been behind the systemic siphoning of billions of shillings. Treasury allocated 93.3 billion shillings for the health sector in the 2019-2020 financial year, nearly 3 times the allocation 4 years ago. Apart from government funding, the ministry gets billions of shillings from donors each year, attracting cartels that are well connected and deeply rooted within procurement circles.
There shall be no resistance that can stop the restructure of this ministry. If we do not do that, then Kenyans will judge us very harshly when they do not get health services at their clinics and their hospitals.
Seth Olale, NTV.